All right, the Biden administration taking cues from the World Health Organization. White House now declaring monkeypox is a health emergency, just days after the World Health Organization declared it a world health emergency. Take a listen.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations.
There are more than 15,000 monkeypox cases in the entire world. Only 5 deaths. All of them were in Africa. Doctors say it's a mild disease that resolves on its own within a few weeks without any medical intervention, typically. Transmitted through sexual contact, which so far has been primarily between men, originating from raves in Spain and in Belgium. So why is this a health emergency? Joining us now is Dr. Peter McCullough. He's the author of The Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex. Doctor, thank you so much for coming on. Why is this a health emergency? Because it doesn't seem to impact hardly anybody.
No, it doesn't. The WHO has clearly jumped the gun. At 16,000 cases, roughly 80% in the EU, is far short of the 500,000 cases of SARS-CoV-2. That was the level at which the WHO declared an emergency. There's already movement of products. The U.S. in a hyperbolic response has ordered hundreds of thousands of doses of the Bavarian Nordic vaccine, the Jynneos, the double-stranded smallpox, monkeypox vaccine. And we know right now in the United States that there's been about 2891 cases reported as of this week in the CDC. And in a paper by Thornhill and colleagues in the New England Journal of Medicine, 98% are gay or bisexual men having sex with men. 95% of the transmission is through sexual contact. 41% have HIV, and 29% have other sexually transmitted diseases at the same time. So this is basically a sexually transmitted disease issue. It's an issue that it should be and is handled by doctors, and it's not a worldwide or U.S. health emergency.
Why is it only spreading primarily in the gay community? I thought it was like a skin touching thing. Everybody, straight people touch, everybody touches. Why is that?
Well, it's largely a zoonosis, Rob. So there's about 1,000 cases a year in the Congo Basin, and it spreads from animals to man. In the prior U.S. outbreak that occurred in 2003, it was just really from animals to people who handled the animals. The difference here is that it did get into a gay or bisexual population. And, the average person in this group that's transmitting, they can have up to 10 sexual contacts in a month. So they're very active with one another. Yeah. And when the lesions are present, it does spread readily. Now, people over 50, I see. In papers by Beer and Simpson, it's indicated that they're already covered because they've already taken the smallpox vaccine. So older people should have no concern. People over 50 should have no concern whatsoever. We shouldn't have concern about getting on airplanes or traveling or going to restaurants. But I think among the gay and bisexual community and men, now's the time for safe sex practices, making some smart decisions. And we have treatment. We have a drug called Tpox or tecovirimat. It's an oral drug. It's very safe, very effective. There's a case in Dallas this year. The man was treated at home. Yeah. He's perfectly fine. The skin lesions are uncomfortable and painful, especially in the mouth or in the anal area. But they're easily treated with the medicine. This is not a pandemic emergency. It's no time to pull alarms for vaccines.
It's the WHO with another convenient power grab. Obviously, they want to jump in and turn it into an emergency, so they get more funding and they get more, attention, everything else. Yeah, we appreciate it, Doctor. Thanks so much for coming on.
Thank you.